C Morning Show right here on C Today. Now we're offset to our second talk show of the day. Now, according to data taken by the Indonesian Health Ministry from 2010 to September of this year, the country is home to more than 12,000 children who are infected with HIV under the age of 14.
Now, if we look at the numbers, HIV is dominant among children as most inherited HIV from their parents. However, HIV can also be passed along through sexual intercourse. As such, parents have been urged to be more aware of what their children are doing.
So how did HIV spread among minors, and how can we prevent it from spreading it even further? To find out, we'll have a discussion with the Communication and Public Service Bureau Head, Dr. Siti Nadia Tarmizi. Dr. Siti, as always, such a great pleasure to have you. Good morning to you.
Good morning. Hello.
Hello, Ibu.
Hello, Shanas. Good morning.
Good morning to you, Dr. Siti Nadia. Of course, usually we're talking about COVID and COVID forecast, but as of right now, this is very alarming to know that a lot of minor children from Indonesia are experiencing or having the HIV. Now, how did the rate of HIV among children become so high lately, and especially those under the age of 14? They're very minor, doctor.
Yeah. So as we always commemorated World AIDS Day on the 1st December, we keep remember that the new infection of HIV keep still in the community. So we seen the HIV infects this disease is limited to the several things. First, because of the risk of behavior, and then the second one, the transmission is come from the drug user injection. So there's those two things that we know that the HIV can transmit from person to person. But because now the infection still in the community, and the risk behavior such as changing partner without any protection, and then many partners, that's those are the risk behavior. So with that, we know that several people, they are having a partner. So for example, like if they are a husband, usually they always have a wife in their homes. From those risk behavior, this HIV can bring to the household. So that's why the women can be infected because of the risk behavior of their partners.
Correct.
Okay. Now, Dr. Siti, I also want to know, according to the Health Ministry, most minors with HIV are boys. Now, why is that?
Yeah, if we seen, in fact, is first generally why it's not only the children. Yeah, I mean generally all the HIV cases are most on men or boy because of the risk behavior. Yeah, usually when we talk about a man, usually because of their risk behavior, either they have changing their partners, or we know that, for example, if we are a special risk group for such as like MSM or female sex worker or male sex worker, usually they are very high risk on HIV infection. And second one, why the usually teenager are boy, because of the risk of using the drug use. Yeah. So injection drug use is usually among the boys. It's very less if we compare to the women.
Yeah, if we're bringing it back, Dr. Siti Nadia, to the children, or children with children in minor age, those are that is infected, they're most probably inherited the disease from their parents. Now, this can also be prevented, especially if the pregnant mother maintained discipline in taking RVT's treatment. What has been the effort by the Health Ministry to aid parents that already have, or parents and pregnant mothers that already has HIV symptoms?
Yeah, so if we talk about HIV among the children, we can divide into two categories. The first one, the children that usually up to 11 to or 12 years old, which mostly this is because of drug use among the teenager. And if it is below than 10 years old, it usually, especially when we have, since they are babies, yeah, they already HIV positive, usually they got transmit from their mother during the
Right.
pregnancy.
Yeah.
So now the government, in terms of to prevent the transmission among general population, because usually HIV are in the certain population who have the risk behavior. So it's not really happen in the general population, because if you keep you are not changing the partners, or
Yes.
you have a risk behavior, you are not doing that, and you have protection, and of course children should not use drug use, or if they are like IDUs, injection drug user, if they are using injection, they should have not share the needles. So something that those things that can prevent HIV. But in terms of general population, usually because of one partner, either husband or wife, bringing this virus into their home through the previous risk behavior. So that's why the government try to, of course, the first one, how to save the children. So we have a program that we offer all the pregnant women during their first semester of their pregnancy. They have to got 3 tests. The first one, HIV test. The second one is the syphilis test. Then the third one is the hepatitis test. So because these 3 diseases are transmitted during the pregnancy.
Okay, so that's what we need to know, and thank you, Bu Siti Nadia, for telling us that. Now we also, our concern is that there are so many misconceptions in HIV and also AIDS. Now we want to know, are HIV symptoms in children the same as adults? How do we know that it's in the household?
Yeah, we know that if someone get infected with HIV virus, usually we did not see any symptoms come out in their life. So usually when it already comes to AIDS stadium, that we can see so many disease affect this person. But if you only HIV positive, the only way to know that you are HIV through the test. So with the test, we know that we are whether we are HIV positive or not. So the only things is only through the test. So if, for example, like the babies, we know if we found the mothers is a positive HIV, and then I mean that while we offering the pregnant woman to get know their status on the first semester of their pregnancy, is because if we know earlier about our status, we can do many things to treat in order to prevent these 3 diseases transmit to the baby. So if we know already our status in the early stage, we have some prevention drug that prevent this disease to transmit to the children. So, but if it is not allowed to make the mother
Yes.
to reduce the risk of the transmission, we still have certain things for the baby. The first one is we are testing the baby, and then we give the baby the prophylaxis drugs in terms to prevent HIV, syphilis, and hepatitis.
So I want to underline this again, Dr. Siti Nadia. You said if the pregnant mother would have it's going to be scanned and whatnot during the first trimester, then there's a big probability that the infectious or the virus itself would not be infected to the baby. So first, that is such a great news to know. And then if it doesn't go along that way, there are many ways to also prevent the baby to be infected or, to be treated, or this baby to be treated for the HIV positive. Now, I know it's a good thing, Dr. Siti Nadia, that we're living in the 2022, right, in this century where dormant HIV cells can become undetected and also uninfectious now inside the body. What has the government has been doing now to encourage those who are infected to finally to reach that level to be uninfectious and also undetected for the HIV?
We know that HIV now we have the drugs for the treatment. So if HIV positive, they got what we call it antiretroviral drug. So it will reduce the virus, and then later on we will not able to detect the virus itself because the number is very low, which means that first it will not affect to the person who are infected because of the very low, it's not have any effect to the person. And the second one, if we have very low number of the virus, the person is not able to transmit the disease to the other person. So that's why if someone have known their status HIV positive, they need continue to have ARV drugs, so they are able to suppress the virus, so they are able to continue their living, and then they are not transmit to others.
Okay. Now, Bu Siti, what steps will the Health Ministry take in the future to actually socialize the public in being fully aware of the disease, and by examining themselves, and also be responsible in preventing the transmission of the virus?
Yeah, the first one is how to make sure there is no other babies with the HIV positive, or they got transmitted from their mother during the pregnancy. So the screening we offering the 3 tests during the first semester of pregnancy is our priorities. And the second one is not only about screening, and later on we did not link the HIV positive mother or the babies to the care. So it means that we providing any treatment including ARV drugs for those who are positive. And then the second one, of course, for the high-risk population, we keep educate, encourage, and then how to have a protection. Although they have risk behavior, they need to have their protection so they are not get infected with HIV. And the third one is to ensure that if you are having risk behavior, or if you are HIV positive, you are not transmitted to your close family, either their husband or their wives.
All right, so the socialization is there, the program is there, Dr. Siti Nadia, but now, as we know, and also there's reports that from a total of more than 12,000 Indonesian children, only around 7,800 children with HIV receive treatment, while the rest have no access to the medical help. So how can we change this current situation? And is there any early examination for children which can prevent them from catching the HIV disease?
Yeah, first we know that some parents, if they know that their children got HIV infection, it's still like a stigma. So they're not really, or they are afraid to bring their children to the closest health facilities.
Yeah.
So that's why some children are very difficult to access the health facility. Although the government currently already extend the ARV treatment up to the puskesmas, the health post. Yeah, it's not only in the hospital, but we can have ARV treatment through the puskesmas. So it's close to their home.
Yeah.
But because of the stigma, sometimes the parents choose to treat their children to the hospital or to quite far from their home. Yeah, so that's something that we need to educate not only the parents but the community, because HIV person is not someone that we need to have the stigma.
Yes.
If we put the stigma and create discrimination for HIV infected person, they will not have an access to the health facility. But that's the first one. We educate about how to reduce stigma and discrimination among community and the parent. The second one, of course, we extend how to access the ARV drugs for the children, because ARV drugs for the children is not only in Indonesia but globally is still a challenge because of small. It's different, from the adult. If the children take the ARV drugs, is a very different from adult composition. So that's something we need, and then we keep to how to extend this ARV drug for pediatrician.
And just very short answer, if you can, please, Ibu Siti Nadia. Do you think sexual education is needed right now, as it is very dire into the situation?
Yes, because the other programs that I already mentioned, we have another program to the school, especially junior high school and senior high school.
Right.
We call it that Aku Bangga Aku Tahu. So we educate not only for the risk of HIV, the risk of sex behavior, but including the reproduction health. So we teach the teenager how to take care of themselves regarding this.
Yes, the only way to prevent it.
Yes. Thank you so much, Dr. Siti Nadia Tarmizi, for this very insightful talks. We hope to see you soon. Thank you, Bu Nadia. Take care.
Yeah.
Thank you very much, Ibu. You have a great one.
I
think it is our job and responsibility together to prevent this, especially HIV disease that affected children and also teenagers, because they are the younger generation, the future leader of our nation. It is, we're going to return, we're going to take a break right now, but when we return, we have the last leg of the show, and we have some dose of entertainment, so stay tuned right here on the C Morning Show, only on C Today.